Smith, and I'm a student physical therapist from the University of Michigan Flint. How are you today?
Oh, in a lot of pain.
Okay, your doctor sent me just to ask you some questions and see how you're moving around. Does that sound okay to you?
Sure.
All right. Can you tell me your name and date of birth?
Albert Anderson, 6/25/1988.
Okay, I'm going to check your wristband real quick. All right, looks like I'm in the right place. Do you know why you're here today?
I was in a auto accident a few days ago.
Okay. Do you know what day it is today?
No.
Okay. I'm going to ask you a few questions about how you were moving before you were admitted and that sort of thing, and then we'll try moving around. Does that sound okay?
Okay.
Okay. Do you live in a house or an apartment?
An apartment.
Is it just one story?
Yeah.
Are there any steps to enter to get into the apartment?
No.
Okay. Are you on the first floor?
Yes.
Okay. Do you live alone or do you live with someone else?
No, I live alone.
Is there anyone nearby that can help you out if you need it?
My parents and my sister, they live in the same town.
Okay. So prior to being admitted, were you independent with things like driving and cooking and cleaning?
Yeah. Yeah, I did all that. Yep. Did a lot of mountain biking and swimming.
Okay. Do you work?
Yep, I'm a Costco manager.
Okay. So that mountain biking and swimming, that's some things that you do for fun?
Yeah.
Okay. Can you tell me anything about your past medical history? Do you have anything noteworthy?
No.
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 How about your past surgical history?
None.
No surgeries recently in the last 10 years?
No.
Okay. What are your goals for physical therapy?
I just want to get home.
Okay, fair enough. Get back to kind of what you were doing before, like the mountain biking and swimming too, and
Eventually, yeah.
eventually. Okay. Alright, I'm going to check out your range of motion and your strength in your arms and your legs.
Okay.
Okay. So, go ahead and bend this knee up. There we go. Okay, hold it there. Don't let me pull you. Okay, and then I'm going to lift this leg up. Hold it there. Don't let me push you down. Okay. And then can you straighten that leg out? Can you raise it? Alright, hold it there. Don't let me move it down. Good job. And then bring this foot up towards me. Your toes, just like that. Yep. And don't let me push you down. Okay. I know this right one might be a little bit more challenging.
Yeah, it hurts.
We're just going to see how it moves. I'm not going to test so much of the strength. Is it okay if I move it?
It's gonna hurt.
It's a little painful, isn't it?
Yep.
Can you bring this toe up towards, yep, and then don't let me push it down. Good. Yep, that surgery's still pretty fresh, isn't it?
Yeah.
Okay, then go ahead and raise this arm right over your head. Yep, just be mindful of this. And then come back down to about here. Yep, and then hold it there. Don't let me push down. Good. And then can you bring that arm out to the side like this?
Like this?
All the way over your head if you can. There you go. And then bring it down about halfway. Hold it there. Don't let me push down. Good. And then can you make a muscle? Okay. Don't let me pull here. Good. We're going to do the same thing with that other hand. Just bring it right up over your head. Yep, and then come back down to what? Here. Okay, hold it here if you can. Good job. And then go out to the side. All the way over your head. There you go. And then come back down about halfway. There you go. Hold it there if you can. Good. And then bring your arm like this. Okay. Hold it there. Don't let me pull you. Good job. Okay. Now I'm going to check the sensation in your feet, okay?
Okay.
Feet and legs. So I'll just be touching you like this. And then tell me where I'm touching you, okay?
Okay.
So go ahead and close your eyes.
My left foot.
Yep.
Left foot on the side. Left foot on the toe. Right foot on the toe.
Which toe?
The big toe. Right foot. Right foot
On what side?
on the right side.
And then I'm going to have you squeeze my hands. Hard as you can. There you go. And then we're going to do the same thing on your hands. So you can have your hands right on your lap. And then I'll just be touching your hand. You can tell me which one I'm touching where, okay?
Okay.
So go ahead and close your eyes.
Left thumb. Left pinky. Left wrist. Right index finger. Right hand. Right thumb.
Okay. Good. That all seems to be intact. That's really good, Say. Okay, so I'm going to have you sit on the edge of the bed. I know it's going to be kind of challenging with your leg, but I think it'll feel good to get moving a little bit. Okay. So I'm going to help your leg, and you'll just be kind of swiveling over to the side of the bed, and I'll hold your leg for you, okay?
Okay.
All right. Now moving this way.
Ah.
I know it's painful. Is that okay there? Okay. I'm gonna listen to your lungs before we stand up, okay? What's your pain like right now on a scale of 0 to 10? 0 being no pain and 10 being the worst pain.
7.
7 out of 10, okay. Okay. I'm gonna sit next to you. Going right on your skin. Sorry, it's a little cold. Okay, breathe in. And out. Again. 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 Okay, I'm gonna go up through your shirt this way, okay?
Okay.
Breathe in again. Close. Breathe in. One more time. Okay. I'm gonna listen on your back too, okay? Just because you had that pneumothorax, which means collapsed lung, we want to make sure that everything is sounding okay. Okay, breathe in. Breathe in. Breathe in. Breathe in. Breathe Okay. Everything sounds pretty good. I'm gonna check you've got that telemetry monitor on you, which shows us what your blood pressure is, but I just want to make sure it's accurate, okay?
Mm-hmm.
Over 64.
Okay.
Okay. Now I'm gonna get your footings on you. Okay. I'm gonna attach this to your transportable one. And then I'm just gonna check your rest of your vital signs and write them down. Your heart rate is 78. Blood pressure is 99/64, and your oxygen saturation is 96%. You said your pain was 7 out of 10?
Yeah.
Okay. About how tall are you?
5'6".
Okay, I think this will be about tall enough for you. So I'm going to teach you how to walk with this toe touch weight bearing. So that's the weight bearing precaution. They don't want you to put too much weight through that right leg.
Okay.
So they're just having you do toe touch. So you're going to put most of your weight through the handles of this and through the opposite leg.
Okay.
So when you stand up, try not to use that right leg.
Okay.
Try to push off with your hands and grab onto this using your left leg. And I will be managing your tubes and your lines. Okay. So I'll help you stand. I gotta put your belt on and your gown. Where'd the belt go? Let me find the belt real quick.
Got lots of tubes.
Yeah. It's still important to have this on you. That just says like a just in case. Go ahead and slip one arm through here.
Mm-hmm.
And your other arm. Alright. On the count of 3. So putting all your weight through that left leg. Ready? So push off the chair. Yep.
Okay.
And then grab onto here. 1, 2, 3. There, grab on quick. Good. Okay, now we're just gonna walk in a circle until we get to that chair. There you go. So what it's gonna be walker, and then good leg, bad leg. Yep, just having that toe touch. Like you don't want to, like you have the egg under your toe and you don't want to crack it. There you go. There you go. Yep. Yep. Good. Does that feel okay?
Yeah, it hurts.
Okay, go ahead and reach for the chair before you sit down. Again, keeping all your leg through that. There you go. You did really well. Good job. You did really well. First time up with that leg being repaired. Not too bad. Alright. Go ahead and give me your arm here. I just wanna... have a listen again and check your vitals. What's your pain at right now?
7 again.
It's what?
About a 7 maybe. Yeah, it's all tight.
It's super tight. Okay. (104/62).
Okay.
So it's pretty low, but nothing to be too concerned about. Getting up and moving kind of changes that blood pressure a little bit. I'm going to go ahead and look at your other vital signs as well. So your heart rate increased a little bit, so you're at 80 beats per minute. Your blood pressure was 104/62, thank you. And your pulse ox is holding steady at 96. What did you say your pain was?
Like still 7.
Still 7.
It's just my leg hurts.
Okay. So we're going to walk back towards the bed.
Okay.
Again, doing that toe touch weight bearing. So walker, good leg, bad leg. Walker, good leg, bad leg. But you're only touching very lightly on that right foot.
Okay.
Okay, doc doesn't want you putting all your weight through it yet.
Okay.
Okay. So when you stand up, then grab onto this, okay? Okay. Ready? Count of 3. 1, 2, 3. Oops.
Here goes telemetry.
Let's see if we can put this back on. Yeah. All right. I'll push these for you. So walker, good leg, bad leg. Yep, only putting very, very, very little pressure through that affected leg. Yep. Good. Okay, we can back up towards your bed now. Yep, come towards me a little bit.
Better?
Yep. And then it's back right up so your legs are touching. And then go ahead and reach. Yep, and then sit. Perfect. We'll hook you back up to the wall here. What's your pain at right now?
Oh, I'm in just a lot of pain.
Just in that leg, or is it in your chest as well?
Oh, my leg and my head and my chest.
Okay. We'll get this off of you. Well, you did really good today for your first time standing with that leg there. Do you happen to have any walkers or canes or anything like that within your home, your apartment?
No.
Okay. Do you have any grab bars in your bathtub
No.
that you know? Okay. Okay, let's get that back hooked up. You don't want it to come down here. Okay. I'll hook this leg and we're just going to be swiveling in towards bed, okay? Ready? There you go, and straighten that leg out best you can. I know it's uncomfortable. How's your pain right now?
I just hurt.
Okay, so, because you don't have a lot of durable medical equipment at home, I'm going to talk to your doctor and see if we can get you a walker and maybe some other things to make sure that your home is safe. But because of that head injury and the severity of that head injury, they're going to want to watch you for a while to make sure there's no complications or anything like that. And then again with the new surgery on the leg, that's a pretty extensive surgery. So I think the plan is to head to inpatient rehab when they feel like you're all set here, and just continue that rehab and continue getting back to what you were doing before.
Okay.
Okay. If you have any questions, just let me know. I'll see you tomorrow at the same time. I'm just going to take your vital signs once more before I leave.
Okay.
Whoops. So we had about 112/62, so that's good. It's going up a little bit. Still in a healthy range. So we'll keep an eye on that, and then I'm going to peek at your telemetry rate real quick.
Okay.
Okay, your oxygen is holding steady at 96%. What's your pain after making you walk and do all that?
Still in pain.
Still about a 7?
Yeah.
Okay. And then your blood pressure, 112/62. And your heart rate did go up a little bit, but we were moving around, so that's normal as well. 84. Okay, do you have any questions for me before I leave?
No.
All right. Well, thank you so much. I'll be here tomorrow, and we'll move around again and see how you're doing, and maybe try some stairs.
Okay.
Okay. All right.